In this presentation, we have to assume that the correct diagnosis of melasma is made, because sometimes melasma can be confused with a condition called ABNOM, which is a Horis nevus, which requires different treatment. So let's focus on melasma for now. Melasma is a medical skin condition. It is important to take medical history to exclude conditions or medications that the patient may be taking, and sometimes they do aggravate melasma. The pigmentation is caused by melanin, which could be in the dermis or in the epidermis. The cells that produce melasma are sitting in the bottom layer of the epidermis, and these are the melanocytes. It is important to look at this picture and appreciate the different layers, and when we treat, we need to think in terms of layers. The top of the skin is the first layer we should consider when treating melasma. So this layer must be protected with sunscreen or sunblock, especially when going out in the sun, and of course sun avoidance is the best. There are many ways to regulate melanin production. The commonest way is to use an ingredient that blocks tyrosinase enzyme, such as kojic acid or hydroquinone. Once there is reduced production, there will also be reduction of melanin in the epidermis. Using peels may also help to reduce the epidermal melanin. The next layer to consider is the upper layer of the dermis. Certain peels may reach this depth. Deeper peels are no longer appropriate because of risk, and the arrival of lasers make these treatments redundant. IPL can treat pigmentation from epidermis to upper dermis, but in management of melasma, it is less appropriate because it has a broader wavelength than lasers, and sometimes it could in fact aggravate the condition. Laser is probably the only device that can reach deep dermal melanin. Laser treatment is not completely risk-free, and it must be combined with sun protection together with melanocyte regulator. Recently, doctors have tried oral tranexamic acid with some success. But this is not the first line of treatment, but it can be added as an adjuvant to other treatments already mentioned previously. Patient must understand that this is a medical condition. As with most medical conditions, we aim at control rather than cure. Not only the recurrence rate is high, but the condition may actually worsen during the treatment. For example, in diabetes or hypertension, the condition may continue to worsen despite treatment. We suggest that the patient signs a special consent regarding treatment of melasma, and information sheet is given to the patient regarding this condition.